So I've just got back from Birmingham. It was a long drive up there and a long drive back, but certainly worth it. Got a really nice, unirregular hairline, or whatever you call it. But it looks like I've got a really nice dense layout there. You can see obviously I'm still a bit thin towards the back, but that's obviously a procedure for a later date. But yeah, the overall pain factor, because I'll be honest, I think a lot of blokes try and play it down. But the initial, it's not even as bad as a tattoo. The pain's similar to what a tattoo would be, but they use a medical vibrator to distract the brain, if you will. So you do feel a few slight pricks and pinches, but otherwise it's totally bearable, really manageable with the pain. Matthew was really insightful leading up to everything, and obviously I actually paid on the day on arrival at the clinic, instead of paying in advance, just because I don't trust banks, oh, we'll get your money back, and then, but the moral of the story is the op went really smoothly. It was a lot faster than I thought, and Ish was also really, really insightful, really helpful. I mean, we all want your hairline all the way back down here, but obviously if you follow all the natural routes and everything, for your age group and everything, Ish sorts you out. And then obviously all these small ones down here will also bring the hairline down anyway, the irregular sort of layout of the front of the hairline. But yeah, it's like singular follicular units through the front, doubling up through the back, and overall just brilliant service. The technicians were great. Yeah, so 10 out of 10, really, 10 out of 10. Except for the drive up there, which was pretty shockingly bad. I didn't enjoy that at all. But that's obviously just with the COVID-19 and everything that was going on, so it wasn't ideal. No hotel, no hearty breakfast. It was just a piece of toast and at 3 in the morning, and then a drive up there to be there for 8 o'clock. So yeah, but all in all, as I said, 10 out of 10 service, and Matthew and Ish and the technicians were brilliant throughout. And if you have any queries or questions, yeah, you just aim them at Matthew and he's back to you straight away. So I hope the video helps you a little bit and gives you a bit of insight. But that's the first day, literally just after the procedure. And as you can see, I'll zoom in a little bit. You've got quite dense. Obviously, we've got a lot of blood there at the moment. But obviously, if I just give it a good rinse again, every 45 minutes, give it another good rinse, that'll wash away. But the one thing that I will mention again is obviously pain factor. You guys might be worried about the pain. During the whole procedure, there was slight discomfort. Sometimes it felt like somebody was perhaps pressing a finger for a long time, longer than there was necessary. Like, seriously, like, that's minimal pain. And that was after the initial injections that felt slightly like a tattoo, but not as bad. But then once the procedure's over, your donor area becomes very achy, almost like you've got a deep muscle, like an achy back of the neck kind of pain. But honestly, after a few more paracetamol, I actually have morphine from an old spinal injury from the army, and that's helped brilliantly. So no pain for me now at all, just a bit of a tingly sensation on the back of my head. So yeah, all good, all in all. I hope that gives you guys a bit of insight, and helps anyone else who's thinking of looking at Ismail, your grafter, as he is a proper surgeon who really focuses on the patient's well-being and what the patient is after, not so much just being a GP or like a counsellor. He is actually a surgeon. And even for the insight, for example, I learnt a lot about the trigeminal nerve and the maxillary branch, which is all fed through the head, because I'm quite scientific, so I learnt as much as I could, and Ismail is just brilliant. So hope that helps, guys, and I'll try and keep you guys updated, do a video, send it through to Matthew, and then hopefully you guys can see from there as it proceeds. Yeah, I'll take the donor area off. This comes off in like 2 days, and then I can give it a scrub. But I've got to leave this alone. This is like precious gold right now. I want to look after that, all right? So I'm not going near it. I'm not even going to blow on it. So yeah, signing off. Hope that helps.